Not sure where to go when you're hurt or sick, but it's not clearly an emergency? The choice can change your bill a lot.
I'm Maya, and today we are making urgent care versus the ER simple. Urgent care and the emergency room both treat problems that need prompt attention, but they differ in cost, wait time, and seriousness.
The ER is open around the clock and handles serious, life-threatening conditions. It's also the most expensive option.
Use the ER for things like chest pain, trouble breathing, severe bleeding, or signs of a stroke. When in doubt about a true emergency, call your local emergency number.
Urgent care handles minor illnesses and injuries that need prompt care but aren't life-threatening, like fevers, minor cuts, or mild infections. It usually costs far less than the ER. So urgent care is for minor issues at a lower cost, while the ER is for serious, life-threatening situations.
Urgent care centers often have extended evening and weekend hours, but they aren't always open all night. Check ahead when you can.
In a true emergency, your insurance generally can't require prior authorization before you go to the ER, and plans usually cover emergency care. But you may still owe ER cost sharing.
After an ER visit, follow up with your primary care doctor, especially if you were admitted or given a treatment plan.
If you're unsure whether it's urgent, many plans offer a free nurse advice line. Check the back of your insurance card.
For routine or non-urgent needs, your primary care doctor is usually the lowest cost option if you can wait for an appointment.
Quick recap. Urgent care and the ER serve different levels of need.
Use the ER for serious, life-threatening emergencies. It's open around the clock, but costs more.
Use urgent care for minor issues that need prompt care at a lower cost. I'm Maya. If this helped, hit subscribe, and I'll see you in the next one. Let's make insurance simple.